More than 180,000 doses of vaccine have now been administered across the province. More than 107,000 Albertans have received at least one dose, including 73,000 who are now fully immunized with 2 doses. Over the last 24 hours, we have identified 267 new cases of COVID-19 and completed about 6,300 tests. Our positivity rate currently stands at 4.4%. There are currently active alerts or outbreaks in 231 schools, or about 10% of the schools in the province. Currently, these schools have a combined total of 846 cases since in-person classes resumed. There are currently 326 people in hospital with COVID-19, including 51 in the ICU. Sadly, I must announce that 11 new deaths were reported to Alberta Health in the last 24 hours. My sympathies go to the families and friends of these individuals, as well as anyone who is mourning the loss of a loved one, no matter the cause. Starting tomorrow, seniors aged 75 and older will be able to book their appointment to receive a COVID-19 vaccine. I know that many people are eagerly looking forward to getting the vaccine. I also know there are many questions. So I'd like to talk a little more about how this will work, recognizing we will be updating our website with detailed instructions tomorrow. The first question I know many people have is, do you have to be 75 to be eligible? The answer is you need to be born in 1946 or earlier. So if you're 74 and turning 75 this year, you are eligible for the vaccine. The second question I know many people have is, how do I register for my shot? If you are a senior, 75 or older, living in a licensed supportive living facility, you do not need to book an appointment. AHS is already contacting all those sites directly to arrange for you to receive both your first and second dose at the appropriate time. If you live independently in the community, starting tomorrow morning at 8:00 a.m., you can book an appointment through the online AHS booking tool or by calling HealthLink at 811. AHS will start booking appointments tomorrow, but please be patient. Given the risk of serious outcomes from COVID-19 for these individuals, we expect there will be enormous demand for immunization. We have increased staffing for HealthLink to make sure that any senior who wants an appointment can get an appointment as quickly as possible, but we know this will take weeks to achieve. I want to ask Albertans for patience. More than 230,000 seniors, 75 and over, will now be eligible for the vaccine, along with all those in Phase 1A who are still receiving their doses. This is a massive expansion for our province and a big step forward. However, unlike our yearly influenza campaigns, we do not have large stockpiles of the vaccines ready to go province-wide. Instead, we are relying on new shipments that we anticipate will be increasing each week. It will take time to immunize all our eligible seniors, and there will likely be a few hiccups along the way as we continue expanding. But healthcare teams across Alberta will be working very hard to make sure that each eligible senior gets immunization as soon as possible. The rates that are increasing in parts of rural Alberta, certainly they're concerning. It's concerning when rates increase in any part of the province. As to what is driving each individual location, it's not clear that there's a single cause. There are certainly different outbreaks happening in different parts of the province where we've seen within a particular group spread from one to many. So again, wanting to reiterate that importance of making sure that all of us are following those COVID precautions every day. And with respect to what is being done about it, as we do with all of our localized spread, we're working very closely with local public health to identify, first of all, if it's a specific outbreak, that all of the outbreak protocols are put in place in that location. If it's more of a community issue, again, working with communities to make sure that community leaders understand the source of the spread and what needs to be done about it. And again, offering that consistent messaging, which is to say that No matter what part of the province an Albertan lives in, there is risk of COVID-19, and we must continue to follow the measures that are in place in order to keep reducing our cases, in order to save our healthcare system and be able to continue moving forward on this path forward while we roll out the vaccine program.